Welcome to episode 3 of my STI series. I'm glad you made it this far. So today we're going to be talking on chlamydia. Chlamydia is a common sexually transmitted infection that is caused by a bacteria called Chlamydia trachomatis, and it's mainly affect the reproductive system but can also infect the eyes and the throat. It is one of the most common STIs worldwide, especially among young sexually active individuals. Chlamydia is transmitted through unprotected vaginal, anal, or oral sex with an infected person, and it can be passed from the mother to child during childbirth also, leading to eye infection or pneumonia in the newborn. One of the most important things you need to know about chlamydia is that it is often called a silent infection because most people do not have any symptoms, and yet they can still spread it to another person. When symptoms do occur, they may include abnormal vaginal discharge, burning sensation during urination, lower abdominal pain, pains during sexual intercourse, as well as bleeding between periods in women. And in men, symptoms may include penile discharge, burning during urination, and sometimes testicular pain. If left untreated, chlamydia can lead to serious complications such as pelvic inflammatory diseases in women, which can eventually lead to infertility. Chronic pelvic pain and ectopic pregnancy can also come as a result of this, and in men, it can lead to reduced fertility. Chlamydia is diagnosed using laboratory tests such as nucleic acid amplification tests, usually done on urine samples or genital swabs. The good news is that chlamydia is completely treatable with antibiotics such as azithromycin or doxycycline. And it is important that both the patient and their sexual partners are treated to prevent reinfection. Preventions include consistent use of condom, regular STI screening, especially if you are sexually active, and limiting the numbers of sexual partners you have, as well as early treatment when detected. Chlamydia may be silent, but the damage it causes is not silent at all. So get tested regularly and protect your reproductive health. If you have any question, you can drop it on my comments section. I would like to see you in my next episode. Bye.